What is prostatitis? Prostatitis is an inflammatory condition that affects the prostate gland, a male gland that is located between the bladder and the penis, and secretes semen. Prostatitis may result either due to infection of the urinary tract with an infection, which leads to its irritation, swelling, causing pain, or as a result of other diseases or disorders. Types of prostatitis. Types of prostatitis can be classified into 4 types, namely acute bacterial prostatitis, most often caused by a bacterial infection. The symptoms of this type of inflammation appear suddenly. Chronic prostatitis, also called chronic pelvic pain syndrome. Chronic prostatitis lasts for more than 3 months, but is less severe than acute inflammation. Chronic bacterial prostatitis. Inflammatory prostatitis is asymptomatic. This type of inflammation is often diagnosed when tests are performed to detect other disorders of the urinary or reproductive tract. This type of prostatitis does not cause complications and does not require treatment. It should be noted that prostatitis is different from prostatic hyperplasia. An enlarged prostate is a disorder that affects the elderly more often and causes problems with the urination process. Prostatitis affects males at any stage of life after puberty. It is common among young people. Causes of prostatitis. The causes that lead to infection in prostatitis are diverse and may be unknown, and the likelihood of developing prostatitis may be related to the anatomical nature of the genitourinary system in males. The causes of prostatitis in men depend on the type of inflammation. Causes of chronic prostatitis. The causes of chronic prostatitis are still unknown, but it is believed that a microbial infection, but not a bacterial one, has something to do with this. There are some factors that may increase the risk of infection, including the following: nerve damage in the pelvic area as a result of exposure to injury in the area. Urine contains certain chemicals. The immune system's response to a previous urinary tract infection. Psychological stress. Causes of bacterial prostatitis. As for the most important causes of bacterial prostatitis in its acute and chronic form, it is the entry of bacteria into the urethra and urinary tract infection. And what increases the risk of developing this type of inflammation? It includes the following: frequent inflammation of the urinary bladder, having anal sex, having sex with a partner with sexually transmitted diseases without using a condom. Here the most contagious types of germs are chlamydia, bacteria that cause gonorrhea, age-related benign prostatic hyperplasia, abnormalities in the anatomical nature of the genitourinary system, inflammation of the epididymis, perform a biopsy of the prostate, having irritable bowel syndrome. Symptoms of chronic prostatitis. Symptoms of chronic prostatitis include persistent pain for 3 months or more in one of the following areas: between the testicle and the anus, lower and middle abdomen, lower back, the penis, feeling pain during or after ejaculation, pain in the urethra during or after urination, pain in the penis during or after urination, an increase in the number of urination, the urge to urinate, weak or intermittent outflow of urine. Symptoms of acute and chronic bacterial prostatitis. Symptoms of acute and chronic bacterial prostatitis are similar, but differ in severity, since the acute type has more severe symptoms. Symptoms of prostatitis include the following: frequent urge and sudden feeling of urge to urinate, difficulty urinating, considered an early symptom of prostatitis, pain or burning during urination, chills and sometimes fever, accompanied by nausea and vomiting. Depending on the severity and type of prostatitis, pain in the lower abdomen may extend to the testicles. unpleasant smell of urine, the presence of frequent discharge from the urine orifice in the form of sticky dots in the morning, and may cause temporary blockage of the urination orifice in the morning, or they may appear one. Underwear in the form of droplets of yellow or brown viscous liquid, and in many cases patients complain of the presence of long white threads that come down with urine, especially in the early hours of the morning, and these symptoms are considered common symptoms of chronic prostatitis. Also read, know the symptoms of prostatitis and sexual intercourse. A patient with prostatitis may experience pain during sexual intercourse and also during the ejaculation process, and some cases also suffer from loss of sexual arousal, especially in the case of chronic. As for the relationship between prostatitis and erection, it was noted that chronic prostatitis is accompanied by chronic pelvic pain, erectile dysfunction, in addition to feeling various pains in the testicles, penis. There is a high probability of erectile dysfunction in patients with prostatitis, especially in cases of chronic inflammation, and prostatitis directly affects the effectiveness of erection if the inflammation is severe. In less severe cases of inflammation, it leads to pain when erecting, which interferes with sexual pleasure and may eventually lead to ineffective erection. How is prostatitis diagnosed? The doctor may resort to the following measures to diagnose prostatitis. Clinical examination for the diagnosis of prostatitis, in which the symptoms of prostatitis appear in the form of swelling of the lymph nodes in the surrounding area in the prostate and in the system surrounding the testicles, as well as fluid and discharge from the urethra. The prostate is also examined using ultrasound, digital anal examination, where the doctor, during the digital anal examination, moistens the anal and rectal area using a special gel and examines the patient manually, as this examination shows any change in the size of the prostate. Urinalysis, where during urinalysis it is detected that presence of any white blood cells or bacteria in the urine, which indicates the presence of inflammation. Treatment of prostatitis is carried out on the basis of the causative agent, urine culture, through which the type of bacteria causing inflammation is detected. For prostatitis is treated based on the causative bacteria. Laboratory blood test, in which elevated white blood cells indicate the presence of infection or inflammation. Cystoscopy, biopsy of prostate cells to exclude the presence of cancer. Complications of prostatitis. Prostatitis can cause some complications if not treated in a timely manner. These include cysts and boils in the prostate, reflux of urine into the bladder, the spread of bacterial infection to the genital organs surrounding the prostate, the spread of bacteria to the blood, which leads to blood poisoning, sexual dysfunction. The prognosis of recovery from prostatitis is excellent if it is treated in the appropriate way, with the patient following the previous instructions regarding living with the disease. Contrary to belief, having prostatitis does not increase the incidence of prostate cancer. Treatment. Treatment of prostatitis depends on the type of inflammation detected by the diagnosis and on the symptoms. Treatment of infection. If you have acute or chronic bacterial prostatitis, you will receive antibiotics. An acute pathological condition may require intravenous administration of antibiotics in a hospital for a short time. The full course of antibiotic therapy usually takes from 4 to 6 weeks, or even longer in some cases. It is important to take all prescribed medications to eliminate the infection and reduce the likelihood of developing chronic bacterial prostatitis. Symptomatic treatment of urology. Drugs called alpha receptor blockers help relax the neck of the bladder and the muscle fibers at which the prostate connects to the Bladder. This treatment may relieve urinary tract symptoms such as the presence of pain when urinating or difficulty urinating. While these medications are prescribed for men with chronic prostate inflammatory syndrome/chronic pelvic pain, they may be prescribed to relieve urinary tract symptoms caused by bacterial infection. Pain treatment. Your doctor can prescribe painkillers or recommend taking over-the-counter medications such as acetaminophen, Tylenol and others, or ibuprofen, Advil, Motrin IB and others.